Hello guys, welcome back to my channel. As it is a very important topic, watch till the end. So hemoglobinopathies and derivatives we are going to see. So first hemoglobinopathies. Due to mutation in the genes that code for alpha or beta chain of globin in the hemoglobin, some disorders may happen. So why we have to see about alpha and beta chains alone? As in the previous topic, hemoglobin chemistry, I have told two alpha and two beta subunits in hemoglobin. So if there is any defect in alpha or beta chains, then it causes mutation in the genes, which may lead to hemoglobinopathies. So we'll check what are the two hemoglobinopathies will be seen in our topic. So first, two types of abnormal hemoglobin, abnormal structure, and another one is in the synthesis. So first, abnormal structure. If the mutation affects the structural gene, it results in replacement of single amino acids in hemoglobin by some other amino acid, resulting into abnormal hemoglobin. So here, as hemoglobin is a protein, if there is any replacement of one amino acid, instead of one amino acid, another amino acid combines. So that leads abnormal structure and leads to hemoglobinopathies, which may be a structural resemblance. Here, if there is any replacement of single amino acid, there are different causes, there are different hemoglobinopathies may happen. So first one is HbS, sickle cell hemoglobin. Today we are going to see very important 5-mark question. And then methyl hemoglobin, so some replacement of amino acids like lysine, tyrosine, methyl hemoglobin. At once you have to remember, instead of reduced ferric ions will be replaced. So that is methyl hemoglobin. And HbC, which is nothing but lysine replaces glutamic acid in beta globin chain, making RBC less soluble, forming crystals, leading hemolytic anemia. And HbD, it is a abnormal beta chain in hemoglobin, no symptoms in carriers, whereas symptoms will be shown when it is combined with sickle hemoglobin or thalassemia. So these are some of the disorders when there is replacement of amino acid happens. So that resembles abnormal structure in hemoglobin. Next, abnormal synthesis. If there is any mutation affect the regulator gene, so the gene that synthesizes the hemoglobin, if there is any disturbance in the regulator gene which affects the rate of synthesis of peptide chains, the amino acid sequence remains unaffected. Example, thalassemias. So first we'll see what is sickle syndrome. If there is any disorder caused by mutation in genes that code for globin chains. Here I want to explain with this. Unaffected carrier father, unaffected carrier mother. So here unaffected 1 in 4 chance. Right? And unaffected carrier 2 in 4 chance. When unaffected mother and father with their carriers, the carriers means no symptoms. So when they are joining together, particular unaffected 1 in 4 chance, unaffected 2 in 4 chance, but in some case in the third generation, affected 1 in 4 chance, child will be born. So carriers, some particular father or mother may be carriers now without symptoms. Symptoms and இல்லைன்னும் போது அவங்க carriers. But when the gene is expressed, particular symptoms will be expressed. That shows the disease or disorders. So this is called sickle syndrome, and a particular person with a single abnormal copy does not usually have symptoms. They are called as sickle cell trait. When a person inherits two abnormal copies of the hemoglobin gene, one from each parent, they are called sickle cell disease. So gene expressed is called sickle cell disease. Just a carrier, no symptoms, they are called as sickle cell trait with the diagrammatic representation I have given here. Next, sickle cell anemia, production of abnormal hemoglobin. So that's called sickle hemoglobin due to specific amino acid. I have told you one amino acid replaced instead of another. So that is called point mutation. Glutamic acid in the 6th position of beta chain is changed to valine. Here why? Instead of one amino acid, ஒரு amino acid மாறிட்டா அதுக்கு பதிலா அங்க என்ன ஆகுது, ஒரு டிசீஸே லீட் ஆகுது. எப்படி சொல்றாங்கன்னா, glutamic acid வந்து good ஞாபகம் வச்சுக்கோங்க, G, hydrophilic in nature. whereas valine வந்து hydrophobic in nature. So hydrophilic amino acid பதிலா hydrophobic amino acid is replaced. Hydrophobic now water hateable. As it is a water hateable, sticky patches may happen. That sticky patches within the RBC cells may causes depolymerization of the RBC, and that forms a crystals with a sickle shape, and finally it leads to hemolytic anemia. Sorry, sickle cell anemia. Here we should not tell hemolytic anemia, sickle cell anemia. So polymerization of hemoglobin molecules inside RBCs happen, and this causes a distortion of cell into sickle shape. So here I just want to show, no need to write in the paper. I just want to tell instead of glutamic acid. So this is normal one. For glutamic acid, codons are there. GAG, CTC, like the triplet codons, which we have read at +2 level, genetic codons, it will be there. But here once when the point mutation happens, instead of glutamic acid, valine is replaced. So valine is hydrophobic in nature. Glutamic acid is hydrophilic in nature. Instead of hydrophilic, hydrophobic amino acid replaced may causes polymerization of RBC that leads to sticky patches of RBC. So this is a pathophysiology I want to tell. When you're writing in the exam paper, sickle cell anemia, if you're writing like this flow chart, it will be easy for us to give mark. Replacement of glutamic acid by valine in the 6th position. Sticky patches on surface of hemoglobin sickle. And deoxy-HBS has protrusion on one side and cavity on the other side. Many molecules adhere and polymerize to form long fibers at low oxygen tension that distort the cell shape, which leads sickle cell, right? So this is also for information. You just see how far the RBCs sickling occurs under deoxygenated state. When the hydrophobic amino acids are attached to more, like this only sticky patches happen. A sticky patch of one deoxyhemoglobin binds with another to form deoxy-HBS, leading to polymerization of deoxy-HBS to form a gelatinous network of long fibrous polymer. So there is distortion in the shape of RBC, that is, which is nothing but sickle shape. So this is sickle cell anemia. Healthy, instead of healthy RBC, the distortion in the cell shape, RBC shape, that leads to sickle shape. If the sickle shape happens, then it leads oxygen. Oxygen will not be passed easily, so that causes anemia. Abnormal hemoglobin forms strands that cause sickle shape. Next, abnormalities associated with the HBS, lifelong hemolytic anemia. The sickled erythrocytes are fragile and their continuous breakdown leads to lifelong anemia. Tissue damage and pain also happens. The sickle cell block the capillaries, resulting in poor blood supply to tissues, and this leads to extensive damage, inflammation of certain tissues, causing pain also. That's why for anemia patients, pain will be there. And increased susceptibility to infection also. So hemolysis and tissue damage are accompanied by increased susceptibility to infection and disease. Premature death happens. Homozygous individuals of sickle cell anemia die before they reach adulthood. So these are some of the abnormalities associated with sickle hemoglobin. Laboratory diagnosis, sickling test, blood smear test, sickle solubility test, hemoglobin electrophoresis, HPLC method. So sickling test, one reagent is used. This is for MCQ question. They'll be asking what is the addition of, what is the reagent added for sickling test? Sodium metabisulfite. In MCQs, they'll be asking when this is added with the RBC, blood smear test, it will be shown. Sickle shape will be shown nicely. Next, sickle solubility test. Here, solution of sodium dithionate, which is a reducing agent in phosphate buffer, it will be added with your hemoglobin. So, if turbidity shows presence of HBS, whereas normal hemoglobin gives a clear solution. And this is hemoglobin electrophoresis. Electrophoresis already I have told point of application, how far it will be moving. So like that, hemoglobin electrophoresis, one of the tests, we are able to identify it. Management, initial management, avoiding hypoxia, dehydration, and administration of cyanate, which increases the oxygen affinity. Anti-sickling agents also will be added, hydroxyurea, aspirin, and some in severe cases blood transfusions may happen. At last, gene therapy. So next comes thalassemia. Here we have finished sickle cell syndrome, sickle cell disease, trait, and with the disorders I have shown as a diagrammatic explanation. If you're good, you can draw the diagram, and explaining means we'll be giving more marks. So next, thalassemia, name derived from Greek word thalassa. Thalassa, which is nothing but Mediterranean Sea, mostly in that part, the people present in that place will be affected. Thalassemias are a group of genetic disorders characterized by imbalance in the synthesis of globin chain. Here, due to lack, decreased synthesis of alpha or beta globin chain, they are caused two types. One is alpha thalassemia, another one is beta thalassemia. So if there is any defect in alpha subunit, alpha thalassemia. If there is any defect in the beta subunit, beta thalassemia, we will see in brief. So alpha thalassemia characterized by reduced synthesis of alpha globin chain. If there is any defect, because thalassemia defect in the globin chain itself. So no synthesis of alpha. In that case, excess of beta globin within the RBC will be found. So gene for chains clustered chromosome 16, whereas chromosome 11 in the alpha subunit. And it contains 4 copies of globin chains, alpha 2 and beta 2, two copies located on each of the chromosome. So here it is divided into silent carrier. Silent carrier, there is no problem, as already I have told. If the patient is a carrier, no need to worry about that. In a single chain, one alpha subunit is missing, so other three will be taking care. Due to deletion of one gene, hematological is normal state, no clinical state, they'll be acting as a carrier. But alpha thalassemia trait, two copies will be missing. Here, this diagram is very important. You should draw the diagram when we are asking about thalassemia. Due to deletion of two genes from same or different chromosome, mild anemia happens, slightly enlarged spleen, and it doesn't lead to fatal. Hemoglobin H disease, three subunits will be missing, 3 units will be missing due to deletion of 3 gene. Mild to moderate hemolytic anemia happens. So here I have shown the picture, protrusion or enlargement of spleen. So homozygous alpha thalassemia, deletion of 4 gene, it leads to fatal, it leads to death condition, stillbirth, hydrophetalysis or hemoglobin Barrett's disease. Symptoms happens for hemoglobin Barrett's disease. Next, beta thalassemia, synthesis of beta globin chain decreases or stops. Chromosome 11, two genes responsible for beta chains. They are divided into two types. One is beta thalassemia minor, another one is major. So here same thing as that of alpha thalassemia we have seen. Here 3 genes are missing due to deletion of one gene. Beta subunits are missing. 50% decrease in beta chain synthesis. Compensatory happens with the delta and gamma chains which combine with alpha chains. So A2, alpha 2, delta 2 and alpha 2, gamma 2 in the fetal hemoglobin. So what are the symptoms, clinical features after 6 months of birth? Pallor, fatigue, irritability, growth retardation, recurrent infections happen, bony abnormalities, specifically of the facial bones, hemolytic facies, enlarged spleen and liver. So treatment, a regular blood transfusion leads. Iron overload may happen when you are applying deferoxamine, and bone marrow replacement at last. So iron overload alone we have to take care. We have to check the iron level often when we are doing this. Lab diagnosis, severe anemia, microcytic and hypochromic anemia. RBC appears elliptical or teardrop shaped in the peripheral smear test. Mostly smear test will be taken, blood smear test. And at last hepatosplenomegaly, liver as well as spleen will be enlarged. Management, same as blood transfusion, iron toxicity we have to check and treat it by iron chelating agent, desferoxamine. Next, hemoglobinopathies over derivatives of hemoglobin, very important 5-mark question. In the practical classes you will be handling. So hemoglobin derivatives are formed by the combination of different ligands with the heme part. So it may be a oxidized state. Oxyhemoglobin, dark red color. I have given the colors, just note it down. Oxyhemoglobin, red color. Purple color, deoxyhemoglobin. Methemoglobin is dark brown, and carboxyhemoglobin, carbon monoxide, CO, carbon monoxide, is a cherry red, and sulfhemoglobin is green in color. Normally, these concentrations of deoxyhemoglobin is less than 5% of the total. If the level increases, cyanosis occur. So next, this is carboxyhemoglobin, very important thing. It is a colorless, odorless, tasteless, generated by incomplete combustion, and carbon monoxide poisoning is a major occupational hazard for workers in the mines, as well as you should note down when you're traveling through road, you'll be so some nausea, some discomfort may happen because CO will be absorbed easily with the hemoglobin, as it is having more affinity, for example 200 times more affinity when compared with oxygen. So in that case it will be higher, 20%. So when during that time dehydration happens, at that time if we are drinking more water, we are ventilated, means then it may be reduced. Symptoms: headache, nausea, breathlessness, vomiting and irritability happens. Treatment: only one thing, drinking water or administration of oxygen through oxygen mask. Methemoglobin, very important 2-mark question or 3-mark. In subdivision they'll be asking, when the ferrous ion is oxidized to ferric state, methemoglobin is formed. So you should be clear, methemoglobin, every students will be writing methyl group in the hemoglobin. No need to write like that. Oxidized ion will be combined with the hemoglobin to form methemoglobin. Instead of Fe2 plus, so Fe2 plus ion, to Fe3 plus, Fe2 plus will be binding with the hemoglobin. Small quantities of methemoglobin formed in the RBC are readily reduced back to ferrous state by methemoglobin reductase enzyme system. So this enzyme is very important to reduce the oxidized state into the reduced part. If there is any defect in this enzyme only, oxidized ferric ion will be more, and it is bind with the hemoglobin to form methemoglobin. About 75% of reducing activity is due to enzyme system using NADH and cytochrome B5. So this is very very important. NADH, niacin adenine dinucleotide. NADH you will be seeing with the coenzymes reducing equivalence from niacin, and cytochrome B5, very important protein which is formed in the endoplasmic reticulum. So if there is any defect in these enzymes only, it will be leading to globinemias 10 to 15%. Treatment, very important question, MCQ they'll be asking what is the treatment used for methhemoglobinemias. 5 to 10% reduced. Methylene blue 100 to 300 milligram per day, and ascorbic acid or vitamin C 200 to 500 milligram per day will be treated. So this is additional information I want to tell. Methemoglobin may develop by intake of water containing nitrates or due to absorption of aniline dyes. The people, those who are working in the gene factory, will be affected. Aniline dye workers have been shown to develop methemoglobinemia. The drugs also which produce methemoglobinemia are acetaminophen, phenacetin, sulfonamide, amyl nitrite, and sodium nitroprusside. So when taking drugs also, we have to take care of this hemoglobin derivatives. Hemin crystals at last. Ferric positive heme combined with negative chloride to form hemin crystals or hemin chloride, which may be a brown color. And sulfhemoglobin, hydrogen sulfide act on oxyhemoglobin to form sulfhemoglobin. Some drugs also will be leading sulfonamides, phenacetin, dapsone, etc. So these are the derivatives of hemoglobin. We have seen oxyhemoglobin, carboxyhemoglobin, methemoglobin, hemin crystals, and sulfhemoglobin. Very important 5-mark question they'll be asking in the university also. So at last, assignment as usual in my class, very important thing here is sickle cell anemia, 5-mark question. Thalassemia, very important, in a case history they'll be asking. Alpha thalassemia, beta thalassemia as a case history, or as a 5 mark theoretical question they will ask. And derivatives of hemoglobin sometimes they will ask, as it is coming under practical. In theory part, you have to read it. It may be asked also. Very important. Derivatives of hemoglobin is also very important thing. So again, at last, finally, thanks for watching my video. If there is any queries, you can contact through YouTube channel RJ Biochem Expo. So thanks for watching.